So laying in bed for 24 hours as a patient in the hospital is very uncomfortable. So during daytime, we take our patients out, and we do have regular chairs. They're very uncomfortable. So a bariatric sleep chair allows one patient to get out of bed, recline, relax. So it does improve patient satisfaction, the patient outcome. And then, so not only the patients are benefiting, the family, because they like to spend time with, and again, is that patient family center, holding their loved one, their hands being with their loved one during nighttime.
The arms lift up, so if you have a hip surgery, it's easy for the physical therapist to transfer the patient back and forth. It has a push bar in the back, which a lot of the chairs do not. So if a patient needs to be moved closer to the bed to transfer, if you have multiple trauma fractures and you need to transfer into the bed, that's available.
So we're looking for help to purchase these chairs that they're called sleeper chairs. They go from an armchair to a lounge chair to a bed in a matter of seconds. I'll push of a button. So again, they're medically graded. They have multiple functions. They're very comfortable for the patients and for the family, especially when we have hospice patients. Because it looks like if they're using the plastic chairs, just sitting like church, very stressed, and they don't bring the comfort to the patient. So we're looking for your kind consideration. Again, they're really, really great chairs, and we do have few in the house, and everybody is one of the most sought furniture item in the hospital. Unfortunately, everybody's looking for one.
There's a lot of things that we need to do for patients at Arroyo Grande Community Hospital that have to be sent to either Marion or French. And we don't want to send anybody anywhere, anytime if we can help it.
Unfortunately, we have encountered many exams requiring fluoroscopy capability that we are unable to perform due to the lack of equipment. The GE Precision 180 RNF unit. So what does RNF mean? It means radiography and fluoroscopy. So the radiography portion, of course, is chest x-rays, extremity work, hands, feet.
We use still photography for things like if you came in with an ankle sprain or you needed a chest x-ray and want to photograph. But if you came in and you had a problem swallowing, which is an active process that we need to see the video, that's what fluoroscopy does. So that's why, and it's just as easy as your phone, switching from one to the other, and it's in one machine. So we don't have that capability here at this point.
We actually have a room already set up for a unit such as this, where it could almost be like a plug and play. Very minimal infrastructure that's needed to be done. Having the fluoroscopy dedicated machine, even versus the C-arm, just having something dedicated so we can bring on those extra services that we are having to transfer out now. Our patients currently are having to be transferred out and possibly staying at that facility that they're transferred out to or coming back. So that was something huge we would be able to eliminate. We've been having to transfer out at least 1 to 2 patients weekly from an ER standpoint. And that's not even including any outpatient volume that we could gain. Once the outpatient physicians realize that we have this capability, they would definitely be bringing up our volume, and I'll be needing more staff.
The NeoProbe is a brand of a gamma finder or gamma probe, which is used intraoperatively, primarily for mastectomies for breast surgery. They inject a radioactive isotope into the tumor, and it goes into your lymph nodes. So this equipment helps the surgeon find your lymph nodes accurately so that you can have smaller incisions, less dissection. They can get that out, and patients have better outcomes.
The gamma probe currently, we borrow it from Coastal Surgical, so CSI, or we borrow it from Marion. So when a woman comes in, has breast cancer, and we need to find that sentinel node, we use this handheld device to find it. And then the surgeon can find the node with the least invasive procedure. There are estimated 420,000 breast cancer diagnoses a year, and close to 42 will pass away. So this is a very quick, efficient way for a surgeon to go in and find that node. We have talked to a couple surgeons, and they said, if you have this, we can add more patients, and we can see them a lot quicker.